Dr. Sheth, thank you for joining us today and participating in this podcast, and thank you for being such a proponent and a cheerleader for the Wisdom Study.
Thank you for having me.
So tell our audience about the Wisdom Study. Why is it important? Why is it now? Why now?
Yeah, so we are currently entering an era of precision medicine where we want to try to determine the right test for the right patient at the right time. For many years, screening guidelines have had a lot of confusion for patients. And that really is because we've been debating about data that was acquired 40 years ago, and we just keep mulling it over with the numbers. And the problem is that we've been applying this one-size-fits-all concept to all patients and all screening guidelines. But we know that breast cancer is not one disease, and patients are not one type of patient, right? And so this Wisdom trial is the first of its kind, where we're trying to determine a more personalized approach to screening guidelines for women.
What are you hoping to learn?
A lot of things. So we know that all patients are at personal risk for breast cancer. It varies amongst women. And with this test, we're trying to determine your risk before you get cancer in preventive oncology. And based on your risk, we will stratify you to different screening regimens. And so if you find out that you're at ultra low risk for breast cancer, then potentially we may say to you, you know what, start screening at the age of 50, maybe every 2 years. But perhaps we'll find out that you're at ultra high risk for breast cancer. And then we'll say, you probably need to get an mammogram and an MRI on top of that as supplemental screening. And so this study really sort of helps answer that question as to what really is the right test for each female, acknowledging that breast cancer is not just one disease.
And to that point, the Wisdom Study is looking to recruit a lot of women and to have diverse populations. Explain why that's so critical.
Yeah, whenever we talk about these sort of clinical trials, one of the main problems was that it only focused on one type of patient population. And in this era of personalized medicine, we know that all women, ethnically diverse women, have different types of risk for breast cancer. At the University of Chicago, we are lucky to be in the South Side, where we're surrounded by a large population of minority women, which are mostly underserved. And so by having it at the University of Chicago, we are really hoping to engage our neighborhood and neighboring communities and really over-select for African Americans and Latinx females. And the goal is to have their genetic data, their personal risk for breast cancer within this study so that we can make absolutely sure that the data and the results that we get are ethnically universal and ethnically diverse, that they apply to everyone.
This is the holiday season, and Wisdom, along with Life Image and local partners such as the University of Chicago, have launched a campaign for Giving Tuesday. Talk about this gift that women can give their mothers, sisters, and grandmothers.
This is the gift of knowledge, the gift of health, the gift of information, right? By joining the Wisdom Study, and you can join as long as you're between ages of 40 to 74, you can't have a history of breast cancer, you can join and sort of choose what type of regimen you want. If you find out your personal risk through Wisdom, we will assign you a very specific screening guideline for you. So if you find out, like I mentioned earlier, low risk, we may recommend a certain guideline if you're high risk. And with this knowledge, we're not only helping you, but your future generations, potentially your mother, your sister, your daughters, as to what the right test really is for each female.
And it doesn't cost you anything.
It absolutely does not. It's as easy as going on to wisdomstudy.org. It's an online platform. It's kind of a unique one, sort of approaching this 2020 new technology. And you don't even have to change where you get your mammograms. You don't have to change the doctor that you normally go to. It's all through this online platform. And really all we encourage you to do is go ahead, sign up, answer a few simple, easy questions, and you're set up within Wisdom.
All right. Thank you so much.
Thank you.